So let's talk a little bit about inflammation because a lot of disease, whether you're talking about HS, what have you, a lot of these are inflammation always comes into play. How does overweight or obesity impact the body's tendency towards inflammation?
Yeah, so overweight and obesity, we usually see an enhanced or enlarged amount of fat in that, so adiposity. And people don't realize it, but fat is an organ. Like it makes hormones, it makes inflammatory hormones. We call them cytokines. So oftentimes, actually, if you check, even in our conventional way, our allopathic way, if you check certain markers of inflammation, like a C-reactive protein or sedimentation rate, those will be elevated in people who are overweight or obese. And you can also check like these levels of some of these cytokines like IL-6, IL-1, and you'll see those are elevated because we often think that fat mass is more cosmetic. We know that it confers some risk depending on where it is, but fat actually makes hormones. So it potentiates a lot of inflammatory based processes within the body.
So, what are the current treatment options for obesity, and how do you determine what's right for different patients?
Yeah, so there are a couple of injectables and then pills that are FDA approved for management of obesity. The pills came first. So there's some that are FDA approved for short term, and those are like your stimulants. So phentermine and its relatives. And you can only use them for 12 weeks at a time. So it's not sustainable for long term management of obesity. But then we have pills that are combinations of older medications that we've used and saw that synergistically they help with managing weight. So one of them is called Qsymia. It's a mixture of phentermine, which we can use short term for about 12 weeks, and topiramate, which we've used for epilepsy, so for seizures, for migraines. Together, we see that they have a good effect on weight loss, about 5 to 7% of a person's starting total body weight. And that medication and the other one I'm going to mention can be pretty expensive, but because they're older medications, you can prescribe the components. Like you can do phentermine separately, you can prescribe Topamax separately, and have the patient pay pretty small amounts, like $5, $10, to kind of create a pseudo version of that medication. But again, it's about 5 to 7% of your starting total body weight. And as I mentioned, more and more people are falling into the higher classes of obesity, like class 2 and class 3. 5 to 7% is not going to be that great of a weight loss. The other medication is another combination medication called Contrave. It is naltrexone and bupropion. And conventionally, we've used naltrexone for a lot of things. So for helping people with opioid use disorder, alcohol use disorder, small amounts termed low dose naltrexone are used for inflammatory, like anti-inflammatory benefits. We see it for certain kinds of headaches, for blood sugar management. So that plus bupropion, which we use for depression and also as an adjunct to help ADD and ADHD medications work better. Together synergistically, we see that it also causes about 5 to 7% loss of your starting total body weight. And going back to the Qsymia, we're not too sure on how it works. We know the stimulant part gives you energy so you can exercise more. It diminishes your appetite. We're not too sure on how the Topamax or topiramate part works. But with naltrexone and bupropion, the commonality is that they both cut down something reward link in your brain. So like naltrexone, it cuts down the alcohol and opioid reward link in the brain. Bupropion, we use that also for smoking cessation. So it cuts down like smoking reward link in the brain. So we think together they also just extend to food reward link, cutting that link down as well. So it's pretty good for people who struggle with stress eating, comfort eating, boredom eating. So anything where they're seeking a dopamine hit for whatever might be going on in their lives, in their environment. So it works pretty well for those people. But again, it's not that much of weight loss. And then now we have the injectables. So we have our GLP-1 receptor agonists, which we are much, much more popular than these pills. Those are actually considered second line now. So our guidelines for managing obesity say, try and get injectables. And then if you can't, whether for accessibility, cost, lack of insurance coverage, then consider these pills. So The first injectables were the GLP-1 receptor agonists, just solely because now we have dual mechanism ones. So that's basically our liraglutide, which we don't really use because that's a daily injection and not a lot of people want to inject themselves daily. And we have now semaglutide, which is branded under the name Ozempic for diabetes and Wegovy for weight loss, though they're the exact same. So you can use them interchangeably. So a lot of people end up getting prescribed Ozempic off label, but it's literally the same medication. And then we have what I consider semaglutide 2.0, which is tirzepatide. So that's branded under the name Mounjaro for diabetes and Zepbound for weight loss. Those are incredible at weight management. So the semaglutide based ones, so Ozempic and Wegovy, most people can lose about 15 to 20% of their starting weight. And then with the tirzepatide, so that's Mounjaro and Zepbound, people can lose 30, 40. In my own clinic, I've had people lose 50%, like half of themselves, a whole person on these medications. And those are often more tolerable. So the pills have a lot of side effects, like it can make your heart rate fast. A lot of people who have high blood pressure coincidentally can't take those medications, even though high blood pressure is a pretty common comorbidity of overweight and obesity. So with the semaglutide and tirzepatide, you don't run those risks. A lot of the side effects are confined to the GI system. So people can get nausea or reflux, changes in their bowels, but those are a lot less significant or serious than the possible side effects we saw of the pills. So with the advent of these injectables, we saw more efficacy, more adherence, because these injectables that we use more nowadays are weekly administration rather than having to do something daily. So you kind of can set it and forget it, and more tolerable, less serious side effects. So in every way, the improvements of these medications have been vast.